Hello, everyone. Welcome to our webinar on the lived experiences of foster care. So without further ado, I will introduce our first speaker, Sinéad Tobin. She's an assistant professor in the School of Social Work and Social Policy here at Trinity, but she's also a principal social worker with TUSLA, the Child and Family Agency. Sinéad has almost 2 decades experience working as a social worker, and she also has a particular interest in research about transitions for children in care. Sinéad's presentation today will draw on findings from 2 research projects relating to breakdown in foster care, with a specific emphasis on children and young people's lived experience of breakdown. So over to Sinéad now. Please make sure that your microphones are off and save your questions for the end of the webinar, where you'll be able to enter them all in the chat. And try to enter all of your questions to everyone, because everybody will be benefiting from seeing your questions.
Thanks very much, Kat, and thanks everyone for joining today. So as Kat said, my presentation is on the area of breakdown in foster care. And the information that I'm presenting today really is based on and derived from 2 research projects that I've been involved in. So one back in 2013, I completed a master's in Trinity, and the dissertation that I completed for that, I interviewed 6 young people. They were care leavers who had just left the care system in Ireland around their experiences of breakdown in foster care. At the time, there was actually no such research before in terms of young people's perspectives of breakdown. There was the first one in Ireland, and I suppose internationally there was a dearth of research at the time, also about 6 other studies. So fast forward about 10 years later, 11 years later, into my current post, where I work jointly between Trinity and between TUSLA, and embarking on another research project. Really, I was very interested and curious to understand how much more research was there on this topic, on young people's, care experienced people's, their narratives, their lived experience of breakdown within foster care. So myself and a big research team within Trinity, including Dr. Sinéad Whiting, who'll be presenting later on, embarked on a scoping review. So really that's a type of knowledge synthesis that brings together evidence on a topic. So really what we're doing is looking at what's known, what studies have been completed in this field, where young people have given their direct self-reported accounts of breakdown within foster care. And I suppose without giving away any spoilers, really there is still very little information on this topic with young people or care experienced people, whether they're still under 18 or as adults, giving their experiences of breakdown within foster care. So they're the 2 key research projects, and I suppose what they have been inspired by and derived from is my practice knowledge. So as Kat said earlier, I've worked for a long period of time with children in care as a social worker, and also as fostering link social work too. So I suppose that's what's inspired me in terms of completing these research projects. So I do want to tell you about what's involved and what we have found within this research and the literature. But I first, I suppose, want to give you a little job. I want you to consider these questions. So if you could just type in the chat box, we will come to questions later, but just for the moment, if you could type into the chat box, when we say breakdown, when I say breakdown, I've said it numerous times already, what is it that we actually mean by that? Are there any other words that you would use interchangeably with breakdown? So if you wouldn't mind just popping that into the chat, and if you're comfortable too, as Kat says, just share with everyone. And then from a research point of view, what do you know about breakdown in foster care? Okay. Having a look at the chat now. So if you wouldn't mind typing in, what do we mean when we talk about breakdown? What does it mean? What would a definition be? Are there any words that you would use interchangeably with breakdown? And I suppose, what do we know from research on this topic? Ending. Okay, so someone has said ending there. The end of a placement, loads coming in now. Sudden end of a placement, collapse of a foster care relationship. So loads and loads coming in now. Unplanned endings, when a child moves. Okay, that's great. I'll keep an eye on those now. So good to see, I suppose, disruption is coming up. So lots of different words, child moving, so moving endings. Thank you so much for those. Rupture has come up there. So lots of different words and maybe words that you might use interchangeably. So thanks everyone for that. Um, so I had said earlier that for the scoping review and particularly looking at lived experience, people's lived experiences of breakdown, there actually isn't a huge amount of information, but that's not true of the full body of literature on placement breakdown. There is a good body of literature there, but it is mostly quantitative in nature and it's concerned with prevalence. So how often this happens. So for a long time, we had ranges of between 20% to 50% of breakdowns or of placements breakdown. A very recent meta-analysis that of the Western world took in over 80,000 young people had a prevalence rate of 26.26 actually percent it was. So over a quarter of placements, a quarter of foster care arrangements breaking down, ending prematurely. The other body of literature would look at risk factors, so things like the child's age, if they had had previous breakdowns, foster family characteristics like motivations for going into fostering in the first place, and also outcomes. So we know quite a lot about these areas in terms of outcomes for young people when they have had placement breakdown. And they are primarily negative, but these would be deriving mostly from quantitative research. So the language, we could see even in the chat that was coming up there were lots of different words and words we used interchangeably on the area of breakdown. So while the quantitative literature would very much emphasize placement breakdown and is quite clear in relation to that, like the termination, the ending of a placement, when we actually look at the more qualitative experiential data, we say the definition of breakdown is much more contested. It's not as clear cut. And as Bombach had said in 2018, it is far from self-explanatory. The reasons for this are manifold, including problems with conceptualization, how it's understood, and inconsistencies and inaccurate use of terminology in theory, research, and in practice. Another complication is that often care experience people themselves don't use the word breakdown. They may not use the language that we might in practice or in research. Okay, so just so we're all clear on what we are talking about moving forward, the definition as part of this scoping review, I suppose, that we have looked at is when a child unexpectedly moves from a foster family. So for our study, the young person, the adult, the care experience person didn't have to say breakdown or disruption for us to extract that information out. It just needed to be clear from their account that it was an unplanned, unexpected move for them. And the aims then of the presentation really is to go beyond what Barbara and DeFabro had talked about in 2004 as the sterile indicators of breakdown. So those prevalence rates or the risk factors, to really try step into the child's world, their experiences, perspectives, and reflections on breakdown for them. And really, if we think about Laura Lundy's model of child participation, we have these voices, we have these narratives that are out there in the literature. The purpose of today is to try give them space, audience, that's you guys, and hopefully influence. Okay, so let's look at the findings. The first thing to say is that while there's still a limited body of research that looks at young people's experiences of breakdown, there is depth there. And what emerges from those is very highly individualized, multidimensional, complex process. That breakdown often isn't just an event, a once-off incident, it's a process with many different dimensions and complexity. And Hyla's quote here really depicts that. What she talks about, I suppose, the first part, the first dimension and complexity here is that the foster family, the foster care arrangement isn't home. So her quote here says, living with a family that isn't yours is not in your DNA. It's different. It was a huge commitment, a huge contribution, what they did. Here she's talking about the foster carers. but you never feel you belong 100%. So here we're seeing a different sense or a lack of sense of belonging. It's not home, it's not genetics, it's not in your DNA. And that sense of difference is also depicted in some of these other quotes here. So here, Darren, who I think was 14 at the time, felt that he had been dropped into his foster home. When he reflected on why there was a breakdown in that foster care arrangement, he said that he didn't know enough, the carer didn't know enough about me to bring me up, and I didn't know enough about her. So this is quite a simple quote, and from it you might think maybe there wasn't enough preparation for before Darren moved into the foster family and in with the foster carer. But it also really depicts how, for children who are in foster care, often, particularly if they're older, there isn't that tacit knowledge of the family members. They're starting from a different place than you would with your birth family. That sense of difference, I think, is also depicted in this quote. So, an unnamed young person in Bombach's study, how she was treated differently depending on the dynamics that were present at the time. So, and the foster parent's daughter came back to us again and was given my room, and I had to sleep in my foster parent's bedroom then. So, this is something that definitely has emerged quite strongly around being treated differently, a sense of difference, not that full sense of belonging within the foster family. Similarly to this, we see the sense of foster care at times for these young people being a conditional life. So Naima here talks about, when I think about it, the breakdown, it wasn't supposed to be like that. That isn't the life of a normative kid. We don't need to make people love us. We should just be loved. Grow up with the sense that we are loved no matter what we do and not be afraid to speak up or be angry. So here, I think, again, that conditional sense of not being able to be fully themselves or express their emotions, that their situation is somewhat precarious, and what they're seeking, I think what Naima's quote depicts really is unconditional love, but very conscious of a conditional and often precarious situation. Some young people did demonstrate anger, did express their emotions. And actually, what we saw quite strongly from the literature was that for some young people, there were these self-induced breakdowns with behavior, potentially anger, being not just a form of communication, but actually a form of agency, of getting what they felt they needed and wanted at that time. So this is particularly true for young people who had said they felt they weren't listened to by the professionals around them, and that they had to, when they wanted to leave a foster family, that they had to, their voice wasn't being listened to, and that they had to resort to difficult, maybe demanding behavior to demand the attention of professionals and actively try to cause the breakdown. So here's Bombach's quote about acting particularly difficult, provoking reactions, disobeying rules, and stealing. And Annabelle's quote, so this is a young person's direct quote, said that she decided to run away. I decided to do bad things so that I would change foster families. Because I was smart. When I wasn't feeling well, I did what I had to feel better. I did things to make sure that they had to change my foster family. So it was all planned, you might say. So here we see behavior as an active agency. And as I say, this came up quite strongly within the studies that we have located. And we also see some quite sinister reasons why young people may act out or may want to leave a foster placement and self-induce that breakdown. So this young person here talks about, at the age of 13, I finally got tired of her hitting me. So this young person was talking about experiencing physical abuse in their foster home. And as a result, I started to fight. I fought her. The third time we fought, she got mad. She picked up an item from the kitchen and hit me with it, and I took it from her, and I hit her back. I ended up in a residential home. They said I was out of control. So I suppose here we see, as I say, very poignant and sinister reasons for the child wanting to leave the placement because of experiences of physical abuse, but also their behavior of being what caused the breakdown of that foster care home, but actually blame associated for them, that they said that I was out of control. And we've also seen this from some of the studies that we have extracted, also this labeling of young people, that when they get the label of being out of control, being difficult to manage, that's something that they stays with them and they find it difficult to shake off. We also find that young people, so although they might exert their agency, their control to end the foster care arrangement, that actually the next step, the move to the next onward foster family or maybe residential home, is a time of being particularly disenfranchised and disempowered, where they have little say, participation in the decisions that are being made about their own care arrangements. So back in my thesis study back in 2013, here's a quote. So I didn't know anything, like they just kept moving me from place and they weren't telling me anything that was happening. So that's over 10 years ago now, but we still see this very strongly within the current and more recent literature. So Darren here spoke about being really scary, his move to his onward foster family was really scary because I didn't know where I was going or who I was going to live with. In a variety of studies, we see young people talking about feelings of being dispensable, disposable, that at the times of moves, that they were treated like objects, pieces of luggage, or passed around like a parcel. For some, I suppose I talked earlier about breakdown being a very highly individualized experience for young people, for care experienced people. So it's not always a time of disempowerment. For some, it was actually depicted as a time of empowerment. This is Jacqueline, who actively broke her placement down and actually also arranged her onward foster arrangement. I suppose she saw the time of the breakdown as an experience of empowerment and right for her life. Okay, we're going to talk a little bit about the impacts. So I talked earlier about kind of population level outcomes, but if we look at the impacts of breakdown, and I do want to acknowledge here that breakdown impacts more than just the young person, although that's the focus of the studies I have completed. And I suppose where my passion in particular lies, breakdown has serious ramifications for all who are involved, the whole foster family, social workers, professionals involved, as well as the young person and their birth family. But what we do find for young people is that it is a time of multiple losses in terms of losing friendships, school, belongings, sense of community, and sometimes a greater distance to birth family members, but siblings, separation from siblings comes up really strongly and is felt really, really strongly for these young people. In terms of the ending itself, more in here, this is an Irish study, talked about breakdown being emotionally draining and difficult, but actually the impact is longer than the immediacy. John here talks about a sudden ending that he had, which of a placement, which pushed him further and further away from people. So we start to see a little bit about what might be behind why one placement breakdown, one breakdown can lead on to another. We also see loss of self-image. So again, this Irish study, young people spoke about it being breakdown being like a cycle. It feeds into how you feel about yourself or feel about yourself, and a loss of normality. The young people longed for a loving family or a secure place, walks on the beach, simple things, putting the Wellingtons on and going out. But likewise, there are also long-lasting positive impacts, even from situations that have ended in an unplanned way. So Ida, who had recently, when she undertook the research, when she was a participant and shared her story, she'd recently reconnected with a foster family where there had been a breakdown and she had left in an unplanned way. And I suppose what she recognized, that despite that ending, that that family left her an image of what makes a good family, which is really, really powerful. And I suppose speaks to the power, the capacity, and the possibility of foster care. And I know that's something Sinead's going to pick up on in her presentation around permanence. So just messages for practice. I know I'm kind of short enough on time, so I just might pick out some of the key ones here. So again, emphasizing that breakdown for young people is experienced as a highly personalized narratives. So we can't generalize that all young people will feel in the way that I've represented so far. But notwithstanding that, those insights provide the stories, provide a genuine and really, really important glimpse into the struggles and challenges that some young people can face. So I think as practitioners, I know there's many on the call today, I suppose what's most important is to try remember those experiences, remember those voices of those young people. So I think what's probably best to look at more is what care experience people value, what comes from the literature in terms of what they value. So really what they're looking for is professionals who listen, who share space, and when required that they act, particularly if they're expressing concerns about the foster family that they are in or anything within their life. That there's open, clear communication around any upcoming moves, and that young people are involved in that decision-making process. And they did very much value when there were pre-placement visits to prospective carers, which helped them prepare emotionally and kind of gave them control and empowered them in those decisions. For foster carers, really, I suppose it is probably quite simple what care experience people are looking for, that's demonstrating that genuine love and interest in their well-being. Specifically, that they're trained to understand that their behaviours, I suppose, are a form of communication. And there's a lovely quote there from Reeb Schuller around understanding why we're being angry, why we're acting up and not wanting to go to school. And then obviously any type of practice, whether it's professional practice, foster care or practice, doesn't happen in a vacuum. In terms of the systems, young people are looking for social consistency in their social workers, and social workers who have time to spend time with them, to understand their experiences, build their relationships and involve them in decisions. They want intensive evaluations of their carers, and that there's recruitment of carers who can give consistent and loving care. They want continuity of relationships, so remaining connected with birth family, siblings, and consistency. And again, the final one, something that Sinead will pick up on in her presentation, that felt security. So if that's from their foster care arrangements or professionals, that they have that sense of felt security through authentic and trusting relationships. So finally, I think there's a piece as well as looking at what care experience people value, is what do we value, and we being the full system. I suppose reflecting on whether we respond quicker, faster, prioritize behavior of action of young people over their voice or their words. Do we want foster placements or foster homes and foster families? And I suppose in trying to sum up where we're at, although there's some really important quotes and narratives that we have in this area, we still don't have enough information. So this quote here says the foster children are the focus of all measures, so that would be to prevent breakdown, but they are all too rarely the focus of research. And I think that's really important to reflect on that. And I saw this quote actually earlier, just last week, I think it was, up on X. I'm on it and sometimes wonder why I still am. And then I see really important piece of information like this quote. So who is heard and who is not defines the status quo. By redefining whose voice is valued, we redefine our society and its values. So I think this really speaks to the importance of having young people at the centre of what we do within research and also within practice as well. Okay, I'm going to stop there and pass back over to Katerina just to say thank you very much for your time and attention today, and for everyone who's been involved in supporting the various research projects, and mostly, I suppose, to the young people who shared their stories. Thank you.
Thank you so much, Sinead. So please save your questions for the end. And now we're going to proceed straight to Sinéad Whiting's presentation. She's an assistant professor in social work in Trinity College Dublin. She qualified as a social worker in 2001 and has worked in the areas of child protection, fostering, and adoption. Her research interests include practice education and lived experiences of alternative care for young people growing up on state care. And today, Sinead will present on selected findings from her PhD research focusing on lived experiences of young adults who grew up in foster care with permanence. So over to Sinead now. Oh, can't hear you. I think you're still on mute.
Thank you. I was just saying if I can't be heard, someone needs to let me know. So the bar had gone and blocked my unmute button. So it's lovely to be here. Thank you all very much for attending. I know that you're all very busy people. The only thing I don't like about this Zoom and that I can't see you all, and so whenever I make my many hilarious jokes, I'm not going to know how funny you all find me. So I'll just take the praise afterwards if that's okay. So I thought I'd just start by just telling you all a little bit about me for those of you that don't know me, and that I am a qualified social worker. I qualified in 2001. I did my master's in UCD, having done a history degree first. So I came to social work very clear that being a social worker is what I wanted to do with my life. And then since qualification, I have worked mainly within the agency that's now called TUSLA. It was called the Eastern Health Board or the HSE or various different guises in my time there. And most of my working career was spent in TUSLA Adoption Service based in Ballyfermot. And in 2016, I decided to return to college and to undertake some research and do a PhD. And that was driven very much by my wish to be able to engage in practice that was informed by research. I found that particularly when it came to fostering adoption from foster care, that we were often going into the High Court or into the Adoption Authority with young people who were nearing the age of 18, who really wanted to be adopted. And we were being asked by the judges and by the chair of the Adoption Authority, why was it so important to this group of young people who had been in long-term foster care for their whole lives that they're adopted just at this point of turning 18? And I thought, we don't know why. So let me go off and try and figure that out. And that's part of what my research has been about. It has since expanded from what I thought it would be at the beginning to what it became. I started working in Trinity in 2019, just in time for COVID to hit. And I'm a social work lecturer there, and I'm also the practice education coordinator, which is how some of you might know me. And then I completed my PhD in 2023, and I was very glad to get it done, but I still very much enjoy talking about it. And I think all the PhD did was kind of highlight for me the importance and value of research informing our practice and informing the decisions that we make on a day-to-day basis. So as much as I would love to present the entirety of my PhD, I'm only going to present selected findings today. So obviously there's much more to be had, and I can do many more seminars introducing the different aspects of my PhD. But today I'm going to specifically look at this process of co-creation that occurred between young people and their foster carers to negotiate permanence within their long-term foster care placements. And then I'm going to consider the relevance of the findings to social work practice. All of the young people that I interviewed had grown up in long-term foster care with permanence. They were in their 20s whenever I met with them, and they were reflecting back and looking back on their lives and thinking about what their life had been like growing up in foster care and what gave them that sense of permanence that they said that they had. So as well as talking about their current lives, they also talked about their childhood and their experiences of growing up. And they're the pieces that I'm going to focus on today. So why did I look at this topic? Like, why is this topic important and something that we should consider for research? So first of all, permanence has been the cornerstone of child placement practice since the 1960s. It is something that we have often thought as being very important, that we establish permanence for young people in long-term care. And up until recently, we have mainly understood permanence to be legal permanence. So through adoption. And many other jurisdictions have gone and introduced policies that have allowed for adoption to occur quite quickly in a child's care experience, and it has become a central part of their process. It's not something that in Ireland that we have leaned into too easily. And as our understandings of the importance of permanence have kind of been shifting and changing, we've come to understand that permanence is not just about being adopted, or it's not just about having a legal status within our foster family. It's also something that we see permanence as being grounded in the concept of relational permanence. So that's whenever young people find that permanence exists within the context of strong and enduring emotional ties within their placement. So Sinead, the other Sinead, referred to that briefly there, that the importance of young people feeling safe and feeling loved and feeling secure within their placements. And a lot of the research that has been done over the last 5 or 6 years very strongly points to the fact that young people in care value relational permanence over legal permanence. And so that means that we have to kind of understand more about what is relational permanence, what does it look like, and how does it come to exist within the context of foster care? How can we shift our thinking from focusing on legal permanence to begin to think about relational permanence, this more subjective idea? There's very little research that describes how relational permanence is established. And in fact, I didn't find any research that could help me to understand that whenever I was doing my PhD. And so I was very lucky that whenever I was talking to the young adults that I met, that a lot of them did talk about their experiences of growing up in long-term foster care and described how relational permanence came about for them. And so that's what we'll be looking at today. And there's also very little research that looks at how relational permanence is impacted by the experiences of youth transitions, including the transition out of care. So we do know that a period of transitions, whenever young people are moving from being a child, a teenager, an adolescent to adulthood, that's quite an important pivotal point in their life. And there's lots of things that shift and change. And so taking a lens of youth transitions can help us understand how other experiences in a young person's life are affected. So both this idea about how relational permanence is established in care and how relational permanence is impacted by experiences of youth transitions were themes that came up in my research. So that's what I'm going to look at with you all over the next little while. So just to tell you a little bit about how I went about doing my study. So it was a qualitative study, which means I very much focused on the lived experiences of young people themselves, of young adults themselves. I didn't look to statistics. I looked to what people had to say about their experiences. I interviewed 22 young adults who were between the ages of 22 and 30. They had all grown up in long-term foster care with permanence. And so the criteria for that was that they had to have been with their foster family, the same foster family, for at least 5 years before they turned 18, so before they exited legal care at the age of 18. And they had to have an ongoing relationship with their family into adulthood. So all of the young people I met had been at least 5 years with the same family and continued to have a relationship with them since they had left care. I conducted semi-structured interviews, which were just about helping the young people explain to me what their lived experiences were about. And then I did some thematic analysis to look at the common themes that came up. And of the 22 people that I interviewed, 9 were adopted as older teenagers by their long-term foster carers, and 11 were not adopted but remained a part of their foster family. Of the 9 that were adopted, they had all lived with their foster family that adopted them throughout their childhood, so not just adolescence, but throughout their childhood. And they were all adopted whenever they were 17. So anyone here from adoption services or anyone that's been a children in care social worker doing an adoption from foster care knows the stress of that. But one of the things that came out of my research is it's still important to young people to be adopted, even if they're on the cusp of leaving care. And I'll look at that later as well. So while asking the young adults that I interviewed about their current lives, they all spoke about their experiences of negotiating permanence while growing up in foster care, as well as describing their experiences of permanence in early adulthood. So this was kind of like an accidental finding. It wasn't something I went in looking for, but it's been a very useful finding for me. And I think it's very useful for us to understand this as practitioners about how it is that young people establish permanence within long-term foster care. So most of you here, or all of you here, are working within the Irish context, but I suppose just to help us understand that this is not usual and it's different to the international context. So whenever I go to international conferences, and when any of us that do foster care research talk about the Irish case studies, it is quite different to the way other jurisdictions operate. So in Ireland, foster care generally exists within the context of long-term stable placement. So it's not unusual for young people to be in long-term foster care. And that's where permanence comes from, as opposed to adoption, which might be more common in other jurisdictions. In 2023, at the end of 2023, there were just over 5,000 young people in foster care in Ireland. And of that number, only 30 were adopted that year, which again, in the context of other jurisdictions, is a very small number, where they would be having hundreds or thousands of young people adopted. And that number is probably slightly inflated because it's a post-COVID catch-up number. I think numbers have settled a little bit. When I was working in adoption services, there was only ever 5 or 6 young people adopted every year. I do think it's increasing, though, with the new legislation. Whenever you're adopted in Ireland from foster care, you're adopted by long-term foster carers. So in other jurisdictions, you would be freed for adoption and then you'd be moved to a new adoptive family. So in Ireland, we don't have that. So there is consistency for the young people between their fostering experience and their adoptive family. And so all of that means that in Ireland, permanence is very strongly grounded in relational permanence, which makes it a good place for us to understand this and for us to help the rest of the world understand how you can negotiate relational permanence in long-term foster care. And the permanence does continue beyond childhood. And in 2024, TUSLA reported that 46% of young people in foster care remained living with their foster carers until at least 18 and beyond that. So they continue to live there after they turned 18. We don't have any statistics really about what happens to them after that. And it could be that once they're finished school and that they do leave those placements, but that's something it would be good to know more about. But it does suggest that permanence continues for these young people after they reach 18 and leave care. So my research findings identified a number of examples of the process of co-creation of relational permanence. So this is something that involves both the foster carers and the young people co-creating permanence together. And so the following quotes that I'm going to give are going to give you just a flavor of some of the examples of this and what that looks like. They're representative of the majority, but are not the sum total of all of the findings that I have. So one of the first key findings is how young people talked a lot about the use of titles and names to denote their sense of family belonging, and that they really valued this, and this was something that was important to them. Sinead talked about people not feeling that they belonged. All of the young people that I interviewed talked about having a real sense of belonging within their foster family, and that definitely contributed to their sense of permanence. So Gillian, who had lived with her foster family since she was 13 months old, so throughout her whole life, and she was in her very late 20s when I met her, and continued to have a very meaningful relationship with her foster carers. She described during her childhood how the social workers wanted me to call my foster carers by their names, but I have always called them Mum and Dad because that is who they are to me. And they buy me birthday cards with "Dear Daughter" written on the front in big letters. So this sense of being allowed to call her foster carers Mum and Dad, and them giving her a card with "Dear Daughter," really felt for Gillian like her sense of belonging was being established and it was being fostered within her foster family. So Gillian chose to call her foster carers Mum and Dad, and she believed this described her relationship to them. So she wanted what the names that she used to refer to them to really be reflective of the relationship she felt that she had. And then her foster carers in turn reinforced this by buying her cards with "Dear Daughter" on them. So it was almost like a public display to the outside world of saying, she is our daughter. And a lot of the young people talked about this, and they would talk about calling them Mom and Dad when they were at home, referring to them as Mom and Dad, and then having to switch to first names whenever they were with their social workers. They felt as well that calling their foster carers by their first names to their friends not only belittled the relationship that they felt they had with them, but it also meant they had to then explain their life to them. So why do you call your mom and dad Sinead and Mark, you know, that they would have to then explain, so it almost revealed their foster care status. So being allowed to call them mom and dad, or choosing to call them mom and dad, and then them reinforcing this with dear daughter, really just allowed them to feel this sense of belonging, and helped establish relational permanence within the foster family for Gillian and the other young people I met. This was a really interesting finding that came up in quite a number of the studies the cases that I spoke to, the young people that I spoke to. They talked about the setting of boundaries and by the foster carers to kind of keep the young person grounded, and then their willingness to adhere to these, and this being tied to their sense of belonging and their sense of permanence. So Ben, who was 5 whenever he was placed with his foster family, and he also continued to have a very good relationship with them. He said, I was constantly in trouble and arguing with my foster carers. They would be hard on me, and I knew that it was for a good reason. At one stage, I was told I had one more chance before getting suspended from school, and that was a kick in the teeth. I knew I needed to knuckle down, and I did, and I got into college. My foster carers were hard on me, but I knew they wanted what was best for me, and that's what made me feel like, yeah, this is where I should be. It just felt like home. So the foster carers set high expectations and boundaries. And interestingly, Sinead referred to birth children being treated differently, or the foster children feeling they were being treated differently to birth children. With young people like Ben, when I spoke to them, they often spoke about how their foster carers had the same expectations of them as they did of their birth children, or that any set of parents would have of their birth children. And this is where the setting of boundaries and the high expectations really felt like a sense of belonging to the young adults. They said they felt like when their foster carers did this, they were saying, we want you to do well, we want you to succeed. And that is what any parent would expect. And so the foster carers set the expectations, but then in return, the young adults chose to respond. So Ben made this decision when he was 16 to actually say, okay, I want to make this work, and to take the support that his foster carers were offering him at the time, making sure he wasn't suspended. He did say he wished he could go back and apologize to his teachers, which I thought they might appreciate if he did. So that's them. And then just the third example I have is the inclusion in key family events and the willingness by the young people to be included in these. And this is quite an emotive quote, I think, from Doreen. She and her foster sister both lived in this foster family that had 3 birth children living in the family. And Doreen talked about one of the younger children, birth children, was making her communion. And the foster carers had a professional photographer. And her foster sibling weren't really sure what they should do. So they kind of stood back a little bit, and they were watching this family take their photographs, get their photographs taken. And then she said, for one of the communions, the foster carers had a professional photographer. And I remember she was taking a picture and I was standing back. But the foster carers were like, get in. And I got in. And to this day, that picture is still hanging in their kitchen. It's like a big, massive picture. They were like, absolutely, you have to get in. They weren't even ashamed to hide me. So for Doreen, again, it's very reflective of the other examples of being allowed to call your foster carers mom and dad. It's that sense of belonging and you feeling that you are a part of their family, that your foster carers want you to be a part of your family, and you saying to your foster carers, I want to be a part of this family as well. So the foster carers invite Doreen into the family photo, allowing her to be a part of this significant family event. And I think in Ireland, we know how important communions can be as a cultural significance in a family. And then Doreen chose to be photographed with the family and to allow herself to be part of the family. And she continues to draw meaning from that, seeing that photo on the wall. She's still very proud of the fact that she continues to be there and she continues to be in the photograph on the wall with the rest of the family. So those young people, the 22 young people that I met, they all described very clearly this process of permanence being co-created throughout their childhood. They described a range of things, such as the 3 examples I gave, that they and their foster carers did together to create this sense of belonging and ownership, and created a sense of relational permanence. None of the young people described being uncertain in childhood about their sense of belonging to that family. But then we talked a little bit about as well about what happened whenever they reached 18, because I think that those of us that have worked in foster care know that we have families that we work with where the young person has lived there and they have lived there their whole life, and we see it as a long-term permanent placement. And we just presume that it will continue on. And although there's very good aftercare planning, the participants still spoke about, even though they were certain of the sense of permanence in childhood, that they became a little bit less certain and a little bit concerned as they approached the point of leaving care. And that moments of youth transitions, and particularly the transition out of care, became a moment whenever they had to renegotiate permanence with their foster carers. That they began to doubt this and they began to wonder about it. And so they had to engage in acts to renegotiate permanence. So they all talked about the lived experience of youth transitions as they described the renegotiation of permanence within their foster families, even though they had all described co-creating permanence during their time in care. And so for the next few slides, I have some examples of this renegotiation of permanence during a phase of youth transitions. So Helen, who was one of the young adults I met, she was placed when she was 6 years old, and she had had a previous placement before coming to this foster family. And she said, it was always said to me that the placement was long term and that I was not going to have to go anywhere, even when I was 18. But that is a big thing for us care leavers. When we turn 18, where do we go? My foster carers were always saying, we are your parents. A normal family wouldn't kick their 18-year-old out of the house, and we are not going to do that. You're going to go to college, you're going to be living here, and when you are ready, you can move out. You can live here until you were 40 if you want. I'm sure they didn't really mean that. I have a 20-year-old, I don't want to hear till she's 40. But you can see with Helen why this was so important for her, that you would think from the outside looking in, she had been there since she was 6. All of her child and care reviews had gone well. She was very settled. She didn't describe any difficulties in her childhood or any uncertainty in her foster care experience. But as she neared 18, as she neared this sense of leaving care, she began to doubt or to feel uncertain, would this permanence continue? And so for her, the permanence that had been co-created in childhood became uncertain as she moved out into early adulthood. And so she did need to renegotiate the permanence. She needed the reassurance from her parents. Helen went on to describe to me how her foster carers rewrote their wills whenever she turned 18 to show that she was a part of their family, to have her named as somebody that would inherit their home and any financial money that they had for her. So, and that was really important for her. And when she was talking about it, she got quite emotional, like kind of recalling it and coming back. She was about 25 whenever I met her. And then Joanne, thank you, Kat. Then Joanne, who was placed when she was 7 and only had one placement, she described co-creating permanence while she was in care. So she said, I sat them down, her foster carers, and I said to them, okay, have I moved out full time or what? She had moved to go to university. And my foster mom and foster dad said to me, no. And there's always a bedroom for me in their house, and I can go home at weekends, holidays, whenever I wanted. So Joanne felt she had to sit down and go, okay, I'm going to college now. I'm moving out. Is this it? Can I come back? Can I not come back? And again, she had this long-term permanent placement that nobody doubted. So she had to move out of home independently when she was 20, and she was still uncertain, and she needed to seek reassurance that she could return home. And then there was Jennifer. Jennifer was placed when she was 4 and she had one placement. She said, if I had not grown up in my foster family, I would not have any stable relationships. But we lived with so she had a baby, and she was talking about renegotiating permanence as she became a parent. But we, her and her child, lived with my foster mother and my foster father for over a year when the child was born. And now my daughter can really see what family is. She calls my foster dad granddad, my foster mom is Nana, and all my older siblings are her aunts and uncles. And when she gets older, I want to explain to her how lucky I am to have all these relationships. Because if I didn't have a stable family growing up, I would have no stable relationships to pass on to my daughter. So at this point of becoming a parent, she renegotiated her sense of permanence by establishing the continuation of her family. Her mom and dad become grandma and nana, granddad and nana to her child. And so this was really important for her. And there were a few participants I had that were parents, and they all described similar things. I'm conscious of time now, so I'm going to move on to, these my last 2 slides, Kat. So So the key messages that I take from the research that, and from particularly these findings, is that the co-creation of permanence, it wasn't a one-off event. It wasn't something that happened on a certain day or at a certain time or at a child in care review. It was something that occurred continuously, and it occurred across time through a variety of different actions by both the young person and the foster carers. And so this process of co-creation very much involved both the young people and the foster carers. But even whenever they had established permanence, relational permanence in foster care, youth transitions can help us see that they had to renegotiate their permanence during the transition out of care. And so this, their permanence established while growing up did have to be re-established again and renegotiated at various times. So both as they were leaving care, as they went to college, as they became parents at various stages through their range of youth transitions. But the young people were very much agentic actors in this process, and they described making choices which, along with the actions of their foster carers, led to the co-creation and the renegotiation of permanence. And I just have one last slide. Implications for policy and practice. So it's very difficult, I know, to be aware that there's a range of different situations that lead to relational permanence. So creating policy, we have to have a policy that suits as many people as possible. But policies and practices that aim to support young people in care to establish permanence should allow for a diversity of pathways. So we shouldn't focus just on adoption, or we shouldn't focus just on getting a long-term care order or enhanced rights. We should accept that for different young people, different things will carry different levels of meaning. So permanence is co-created, and planning for permanence should include the active involvement of both the young people and their foster carers in the decision-making process. And they should be conversations that we have with them together that reinforce the permanence that they're co-creating together. And we should understand that at different stages in time, even if we think it was permanence looked like it was pretty much there at one child in care review, that over the course of a year or a few years, things may change and you may need to co-create permanence again or renegotiate permanence. So it's important that we revisit those conversations with people. And while relational permanence is important, adoption does continue to be important. And what I did find with my 9 young people that were adopted is that being adopted for them, even if it was within weeks of their 18th birthday, was a very important part of them renegotiating permanence as they transitioned out of care. And so we shouldn't rule out adoption. And while we can't have very late adoption, I don't think anyone enjoys that. It shouldn't be something that we don't ask young people in their teenage years about, or that we dismiss, that it continues to be important. And that the renegotiation of permanence is something we should discuss as part of our aftercare planning, that even whenever we know that the placement has been stable, we should talk to young people about what this means, and to foster carers, you know, can we talk about what life is going to look like whenever you've turned 18? What are the constants that will stay? And can they still visit? Can they still come back? And will you still be a part of their life? And just having those conversations mean a lot to young people. There you go. There's some readings, and thank you all very much for listening.
Thank you so much, both Sinead. I mean, really excellent presentations, one on breakdown, one on permanence. So we have about 7 minutes for the Q&A. Maybe if it's all right, just make it clearer which of the presenters do you address. Maybe just use Sinead T, Sinead W, or speaker 1, speaker 2. There's already been a question about circulating copies of the presentations. I believe that is the case. There's going to be a recording, and the slides themselves could be circulated to those who have attended. So yeah, over to Sinead T, Sinead W with the questions. There's already one in the chat, actually 2.
Okay, yeah, I can read them out, Cass. Yeah, so Mary Reynolds there says, Sinead T and Sinead W, thank you both for sharing this research. It's so positive to see progress in terms of research in Ireland, no matter how small. While there's still a long way to go, I believe ongoing sharing of same for those working with these families is beneficial for various reasons, including development of responses to requests for research. It's so important to hear the voices of children living with their foster carers and parents. Thanks very much for that, Mary. Are there any particular questions? Thanks, Mary. Thanks very much for that.
There's a question there from
is...
Avril, I see. Yeah, Avril's
okay.
a question for you, Sinead, saying on foot of your research and the dearth of Irish research, have there been conversations to review toothless disruption report template and guidance to better inform practice? There you go, Sinead. You want to speak on behalf of TUSLA?
Thanks very much for that, Avril. I suppose what to say with the scoping review is that it's not finalised yet, but it's coming towards its final stages. And I suppose it will be significant in terms of gathering together international research on this topic. So I am very happy. It'd probably be too premature to have those discussions yet, but I'm very happy to have those discussions afterwards and help inform. I mean, why we do research, why it's so important is to impact young people's experiences, foster carers' experiences of this area, and that obviously comes directly through practice, but really that's influenced by the policies that are behind there. So absolutely happy to do that, Avril. Thanks very much for your question.
We don't seem to have questions, but there are some really insightful comments. So there's one from early on that it is often the birth parents that request through their social workers that children call us by our names. And I can totally relate to how foster daughters feel about that. And then there's also a comment about still having a bedroom.
Yeah, I saw that, Tofine, actually earlier. I thought it was really interesting. And I think that speaks, I think that was arising from Sinéad Whiting's presentation around whether you call mum or dad or not. And I think that really speaks to the fragmented position children and young people can, not always, they don't always do, but that they can have within foster care when there are, for want of a better word, so many players, so many actors involved in that situation. You think about parents, courts, social workers. So that certainly came up very much in my research 10 years ago, you know, that it can often be very vulnerable and fragmented positions. So even if you have that co-creation there, as Sinead talked about, there's other external factors that young people in care have to deal with. So thank you very much for bringing that up. I don't know if you want to come in on that.
What a lot of young people in the research would have said would be that they would have called them mom and dad at home, and in private it was keeping it secret from the social workers they found stressful. They fully understood. I could do a whole other presentation about birth family and the importance of that. And I think their sense of being able to call more than one person mom and dad also came through, that they didn't see it as quite linear, you know, and so they don't want to hurt anyone's feelings, but it was more their reflection of social workers asking them not to do it as they saw it, but wanting it being so important to them when they talk to their friends. I thought that piece about how it does force them to tell their story, if they have to call their foster carers by their name, was a really interesting piece, you know, that it stops them controlling who they tell about their life and their information. I could do a whole other thing on next year on birth family relationships and permanence. It's quite interesting.
There's a question from Mary Mulligan, possibly to both of you. Do you think that young people should have the teenage years to work out who they are and what they want before formalizing adoption?
I think that's, you know, that's very interesting. I think that along with anything, that people develop quite differently. And so I think that if they want to be adopted when they're younger, I don't think we should dismiss that. But equally, my worry would more be that we're going to prevent young people asking to be adopted when they're 16. And obviously there's very practical reasons that I'm very aware of around that, just around the time it takes to process it. But if we don't allow later adoption, because we're one of the very few countries, if not the only country, that do currently have late adoption, that we take away the right of people when they're 16 or 17 or 15 even to say, actually, now I do want to be adopted. A lot of the research, again, that I did with the young people showed that their decisions around adoption were also tied to their conflicted feelings about belonging to two families and not wanting to upset anybody. So I think sometimes it does take the teenage years, but sometimes they also know when they're younger. So again, it speaks to young people having control and being involved in the decision-making process.
Thank you. Then there's a question to both from Jer Brophy. Any key messages that you think would be really useful to share with foster carers and then for children in care to improve our care systems?
Yeah, I think one of the articles in particular stood out to me from the experience of breakdown. There was one where just young people, adolescents, were interviewed, and that talked so much about adolescence just is a time of often as rebellion for all children, regardless of their care status and whether they're in care or not. And that really stood out to me and spoke to me about how much permission, really, children and young people? Is there a different threshold? Are there different expectations that we have for children in care, be that residential care or foster care, from those normative experiences where many adolescents will try to beat the boundaries? Notwithstanding, when we think about the children and young people, many of whom will be in foster care, the traumas and the pre-care histories that brought them to care in the first place. So definitely, I think that trauma perspective, that real understanding of stepping into the child's shoes is really, really important. So probably the key message for me standing out.
Thank you. And then there's a question from Olo. Just wondering how you would describe your own experience conducting the research.
I mean, it was fun, but also a nightmare, if you could describe a PhD like that. I think it probably depends. If you enjoy research and you enjoy spending time talking to people and learning more about a topic that you're very invested in and you care very much about, then research is really good fun if you have time for it. I stupidly did it just after I turned 40 and I still had 3 quite young children who I thought were old enough to cope by themselves. But I don't know, Kat, I see you have a PhD as well. I don't know. It's fun. It's really worthwhile, you know. I'm really glad that I did it. And I think I'm really glad that I was able to do research that is relevant to practice.
Thank you. Then there is also a comment that could be a question. Some foster carers can't afford to their adopt foster children, as the foster children in court lose out on the financial component of the aftercare service if they're adopted. So if you could comment on that.
I know that's a big thing. And I remember from practice that often foster carers are embarrassed to say that and they feel bad about it. And I think young people maybe have to face up to the reality, but it also speaks to policy. If we value adoption as a part of people's permanence journey, then, and we're going to have to pay the foster carers anyway, then maybe we would make policies that allow us to continue payments so that money doesn't become the reason. Because I mean, we all know that foster carers being required to stay at home does mean that sometimes they give up earning potential to look after children in their care. So I think I agree, absolutely, I agree, that's true. And I do hope that whenever I get time that I will do research with foster carers and that I am sure is something that will come out in that research. Although you shouldn't be sure of what will come out in any research.
Thank you so much to everyone, to both Sinead and to all the participants on behalf of the Trinity Research and Childhood Center. So Elizabeth has just put it very clearly in the chat that the webinar recording will be available both at the School of Nursing and Midwifery website and the Trinity Research and Childhood Center website. And all of your questions and comments have been extremely useful. Thank you so much. Do you have any final comments, Sinead?
No, just thank you very much. Thanks for the opportunity to talk to practitioners and to talk to colleagues. I really enjoy it. And thank you very much to Trick for supporting that.
Yeah, thanks everyone for joining us. It's great to see such interaction from people and great questions and comments. So thank you so much.